Hi, everyone. I'm Dr. Sarah Nandolia, and I'm one of the third-year pediatric gastroenterology fellows at the Johns Hopkins Children's Center. Today, I'm sharing a brief overview of a project I presented this year at the annual North American Society of Pediatric Gastroenterology, Hepatology, and Nutrition, or NASPGHAN conference. This work focuses on chronic diarrhea in infancy, a condition that remains one of the most challenging and resource-intensive presentations in pediatric GI. Infants with diarrhea lasting more than 3 weeks often undergo extensive evaluations. This includes endoscopy, biopsies, electron microscopy, infectious testing, and multiple formula trials. Yet, despite all of that, many infants are still discharged under very broad ICD-10 codes, such as unspecified diarrhea. This vagueness can often obscure a wide range of congenital and genetic enteropathies, including rare monogenic disorders that require early recognition to prevent malnutrition, dehydration, and progression of disease. These includes brush border enzyme defects, transport abnormalities, structural epithelial disorders, and immune dysregulation syndromes, to name a few, all of which are now detectable with commercially available gene panels. Why this matters? There are three major reasons this matters, especially for clinicians. First, diagnostic ambiguity has consequences. In our national analysis of hospitalizations from 2015 to 2022, unspecified diarrhea was the most common diagnosis for infants with chronic diarrhea. And importantly, it carried a measurable in-hospital mortality rate of about 0.37%, representing 225 infant deaths across the study period. Diagnostic uncertainty and can delay appropriate treatment and contribute to preventable morbidity. Second, rare but treatable disorders are often being missed. Many infants likely have undiagnosed congenital diarrhea disorders, conditions that can be managed effectively once the genetic etiology is actually known. But in real-world practice, unfortunately, they're rarely identified during index hospitalizations. For example, congenital sucrase isomaltase deficiency, or CSID, appeared only about 65 times in our dataset. Yet these admissions had a median length of stay of 6 days and median charges exceeding about $32,000. This suggests that many rare conditions are being misclassified under broad, non-specific ICD-10 codes. It also highlights a persistent gap between the diagnostic tools we have and how often they're actually used early in a child's evaluation. And third, the impact extends beyond just the index hospitalization. Diagnostic uncertainty leads to prolonged hospitalizations, repeated admissions, and costly diagnostic cascades, all of which place a heavy burden on families navigating weeks or even months of unanswered questions. Earlier use of genetic testing and improved classification frameworks could shorten that diagnostic journey and allow infants to receive targeted therapy sooner. What we hope to improve. There are a few major takeaways I hope this work highlights. First, when you see an unspecified diarrhea diagnosis in an infant with symptoms including prolonged diarrhea, consider congenital diarrhea early on. Second, genetic testing should occur earlier in our algorithms for these infants. Current congenital diarrhea panels cover dozens of genes associated with early onset diarrhea, and understanding their diagnostic yield and coverage gaps can help us use them more effectively. And third, we need better ICD-10 coding frameworks and classification algorithms to help decrease disease burden in infants with congenital diarrhea. Accurate coding can help us measure disease burden, strengthen provider awareness, and transition from diagnosis by exclusion to precision diagnosis for infants with chronic diarrhea. Thank you so much for watching, and a special thank you to the pediatric GI team at Johns Hopkins, including Dr. Carnsicle and all of our research collaborators that have made this work possible. I appreciate your time and interest. And if you'd like to connect or are interested in exploring collaborations, please feel free to reach out.